To talking about joints, and this time it's TMJ. I'm going to switch it to the PC screen. So TMJ, as you can infer from the name, is temporomandibular joint. So it's a joint between the temporal bone, right here, and the mandible. Okay? Actually, it's condylar process and mandibular fossa. Condylar process of the mandible and mandibular fossa of the temporal joint. It's the most easily dislocated joint in the human body. I will tell you a little story about it. And there are two types of movement in that joint. I didn't do anything, I promise. Okay, it's the easiest joint to dislocate. The hinge joint allows you to depress and elevate mandible, and gliding movement in the joint allows you to grind food between the teeth. Okay? If we go back and look at the structure, it turns out there are two synovial capsule. Two joint cavities, the superior cavity and the inferior cavity. Okay? That actually allow that multiplicity of movements. Now, before we get to the problems with joints, here's the story. I'll be honest. I tell it. I love this story. It's the story of human stupidity. Tell it to every class. So it's an easily dislocated joint, and if jaw gets dislocated, surgeon can put it back fairly easily, like pop it in. Much less common is the issue when something gets stuck in the mouth. Right? I mean, I never, even when I attempted to eat the whole tomato, it was a heroic effort, but I still managed to do that. It didn't get stuck in my mouth. Here's the story. It's a true story. It happened back in my home country. So two friends started to drink in the evenings of Friday. You know, they drink, get drunk. One of them says to another, dude, I bet you can put the light bulb, like a regular 60 watt light bulb, in your mouth, but you cannot take it out. It cannot be so. Well, how you can resolve this bad? They take the light bulb and the guy sticks it into his mouth. Guess what? It goes in, but it doesn't go out for some reason. Just can't. I mean, you can crush it, of course, but you can't take it out. So this poor fella sits there with the light bulb in the mouth. His friend, when he stopped laughing, realized that they have to do something about it. So he calls taxi. It's Friday night. They can't drive. They drunk. Friday night. You're not going to go emergency, right? I mean, call emergency. We have a little, like, smaller emergency rooms, mainly for trauma. You go there if you have a broken bone, if you have, I don't know, a cut, a wound, anything like that. That can be fairly quickly fixed. Make sense? So they hire a taxi, they go to that trauma center, and there's a surgeon sitting there. He's not on call, he's just sitting there. Takes care of all patients. Surgeon sees that idiot with a light bulb in his mouth. When he stops laughing, he pops the jaw out, takes the light bulb, pops it back in, sends them home. They come home, they have a couple more shots, and the guy who did not have a light bulb says, look, I can't believe you couldn't get it out, and tries it himself. So they have to call taxi again. To their unfortunate, that's the same guy, the same taxi driver. So he drives them back to the same emergency room with the same surgeon. Well, surgeon, it took a longer time for surgeon to stop laughing. He pops the jaw back. First, of course, he dislocates the jaw, takes the bulb out, puts the jaw back in place, sends them home. They drive home, and taxi driver is kind of interested what's going on. And said, what's going on? And they explain it to him, and taxi driver said, I cannot believe you cannot take it out. Should I continue? Who was the third patient that evening? It's just, it really, it's, how can you not trust your instincts? But it's really fairly easy to dislocate. And actually, the clicking sound, I mentioned that the clicking sound, like when I chew, I experience clicking sounds in the jaw. It's because of not perfectly aligned jaw. Usually it's because of the teeth being not perfectly aligned. Yes. Sometimes it can be, not for me, but in some people it can be painful. In some people it can cause the cartilage deterioration. Generally, if it really bothers, then maxillofacial surgeon will check what's going on. And if misalignment comes from misaligned teeth, they may do something about it. And other than that, there's not much to do. Yes? Mm-hmm. Well, that's great because, as far as I understand, that's what they do. They pretty much align bones in place. But if the problem comes from the dental issue, then it may gradually appear again. That makes sense? Now, the problems with the joints. Well, cartilage tears, ligament tears. So cartilage tears usually not due to the compression, but more due to the shear stress. You will see this term in other aspects of biology. So shear stress is this, when there is a pressure and the gliding motion at the same time. Does that make sense? Like scrubbing. Okay. So it may happen when, say, you carry a heavy weight and your knees are less stable than you think they are. There's a gliding motion in your knee that causes the tear. Okay? Tears are really slow to heal. Also, fragments of the cartilage can actually remain in the joint and lock it. So you can see the tear here in the meniscus. I don't know how clear it is, but it can be repaired with so-called arthroscopic surgery. Essentially, it's a very low invasive procedure. The surgical instruments are inserted into the knee joint along with a little camera that allows surgeon to observe what they are doing, okay, and fix the cartilage. They remove the fragments and repair the ligaments. If menisci is removed partially, it essentially reduces the joint stability. We looked at this before, so it reduces the feet between the tibia and the femur. If menisci are removed completely, you have no protection for either of those bones, whether it's a femur or tibia, from rubbing against each other. So it causes constant trauma, constant injury to the bone surfaces, inflammation, and eventually leads to osteoarthritis. Okay. So in a younger patient, sometimes meniscal transplant can work, and we really may hope for someday to use stem cells to actually grow meniscus, grow cartilage tissue, but I don't know how close it is. Sprains is tears of cartilage, okay? Because if you think about the structure, not the cartilage, the ligament. Think about the ligament. It's the dense regular connective tissue, so there are a lot of collagen fibers. It's like a fabric, okay? So when ligaments are stretched or torn like this, coracoacromial ligament here, okay, when it's stretched or torn, they heal poorly because of the poor vascularization. That's what we discussed. Now, the treatments, the surgical treatment option is stitching them together. If you ever try to stitch two pieces of fabric, doesn't really work. It's not going to be as strong as the fabric itself. Okay. Graft. As far as I remember, that's what what's his name, Adrian Peterson, received when he torn his ACL. Although I suspect he also received some growth hormone to speed up the recovery. Never tested positive, but so grafts are better, and of course time heals. If you ever had a sprain, you know that over time it will repair unless you put any extreme force on it, unless you perpetuate the injury by, I don't know, exercise, unnecessary exercise. Inflammation of bursa is called bursitis. We discussed the bursitis caused by the continuous pressure on the joint, like bursitis in the knee from standing on the knees for a long time. And you can see the bursa inflammation here in an elbow. Tendonitis is the inflammation caused by the overuse of a tendon, like tennis elbow or golf elbow. I don't remember. I think tennis elbow is the what it is, the lateral, the lateral epicondylitis, and golf elbow is medial epicondylitis. So you have to understand here that it's a mechanical stress that goes on and on and on and causes micro injuries of the tendons and bursae. Does that make sense? So I mean, if you constantly like play tennis and when you play tennis professionally, then your tendons in your forearm, muscles of the forearm, they experience constant mechanical stress that causes micro tears. They don't really get healed, so you have a continuous inflammation, and rather than repairing tissue, inflammation starts to cause a problem. The usual fixers for this, non-steroidal anti-inflammatory drugs, ice. For tendinitis, especially for the tennis elbow, you probably eventually it will end up in the surgery. Now they can do the surgery. They detach the inflamed part of the tendon, remove it, stitch it back to the bone, reattach it back to the bone. Using NSAIDs, you cannot use them for extended period of time, whether it's a diclofenac, ibuprofen, or Tylenol, because they cause gastrointestinal symptoms eventually. Steroids are bad. It's a hormone, for God's sake, so it's going to change the glucose metabolism and most likely will lead to obesity. There are steroid shots when there is an injection of steroids right into the elbow, which again helps only temporarily. So eventually it all ends up in a surgical treatment. The most common condition that's associated with the pathological changes in the joint is arthritis. Now, arthritis is like an umbrella name. Like when we say I have a cold, it may be influenza virus, maybe, I don't know, Moxella catarrhalis bacterial infection, or something else. You see the idea? So it's an umbrella name for various conditions of various origin that ultimately lead to the same result. Your joints become less and less movable. Okay? So it's the most widespread crippling disease in the United States. And essentially the joint becomes inflamed, which causes pain, swelling, and as the result of it, stiffness. Because of the swelling, because of the pain, you don't really want to move the aching joint. And sometimes because of the pathological tissue changes. It can increase in a percentage of bone tissue or connective tissue. There is an acute arthritis that can be caused by bacteria, sometimes viruses, and they can be chronic arthritis. Usually either caused by the age or autoimmune disease. So osteoarthritis is irreversible degenerative disease of the joints that, sort of the price we have to pay for becoming older. Pretty much you can see that statistics. By age 55, about 50% of US population develops osteoarthritis, which says it's the usage disease. You use your joints, they get injured, they get inflammation, well, hopefully later rather than earlier, but osteoarthritis will develop in the joints. So it's normal, it's aging, okay? You may ask why we kind of became aware of that disease just recently. Like we now know a lot of diseases that happen at the age of 70, 80. People live longer, A lot of diseases that we now deal with are diseases of old age because we started to live longer. Turns out when we become older, we become sick. Okay, so that same thing with osteoarthritis. So cartilage becomes destroyed, is not replaced, and essentially bone ends become exposed to each other. And they become exposed to each other. That rubbing causes injury and repair, and that repair leads to the thickening of the bone. And in the very, very extended perspective, the bones in the joint may fuse. Okay, so this shows you the appearance of the arthritic hip compared to the normal hip on the X-ray. You can see the bright white accumulation of tissue. That's sign of inflammation and bone growth. Compared to the normal hip, where you see no such sign. There is no cure for that disease, only treatment. So you can treat it with painkillers. This, as I mentioned, not effective, okay? Chondroitin sulfate, glucosamine, they not effective in treating osteoarthritis. Capsaicin creams. Does anyone know what capsaicin is? Huh? Good question. I don't think it is a protein. Where can you find it in nature? In some very fancy food stores, I bet you can buy it. No? Creams that deal with the muscle pain and bone pain. What are the names for them? Like, give me an example. Icy Hot. Where would you find? Sometimes the capsaicin is one of the components of those creams. If icy, okay, hot. Where would you find capsaicin? Yes, peppers. Actually, there are cooks. I mean, there are two meanings to this word as far as I know. People who cook food and people who are cuckoo, right? There are cooks, the food preparing people in the United States that use capsaicin as the spice. So it's like crystallized pepper. It's as hot as you can imagine. Now, my question to you is, the capsaicin in that cream, does it treat the problem? How? How does it block? What does it do with the receptors? It gives you a burning sensation instead of pain sensation. Does that make sense? So that's the whole thing about capsaicin creams. So that's icy hot, those things, they don't really treat anything. They distract your peripheral nervous system, well, central nervous system, from pain to another type of stimulus. Okay? Rheumatoid arthritis is autoimmune disease. Usually starts earlier, 40, 50 years of age. Okay? Women are more prone to this than men, mediated by your immune cells and antibodies. We don't really know what causes it. Like, what is the exact mechanism? Why does it happen in one person and doesn't happen in another? But essentially, your immune system starts to destroy the cartilage. Destruction of cartilage and inflammation will cause pain and swelling. The complicating factors would be anemia, osteoporosis, muscle weakness. It's just a number of more systemic manifestations. But osteoarthritis, this is the picture of the severe osteoarthritis right here. Okay, but we don't really know what perpetuates it. So it starts with accumulation of synovial fluid, inflammation of the synovial membrane, and thickening of the synovial membrane. Eventually, synovial membrane is substituted as the result of inflammation, the so-called pseudomembrane, the pannus. And pannus connects the joints. Okay? And when ends of the bones in a joint become connected and pannus becomes ossified, this is called ankylosis, and joint becomes essentially not movable. It's pretty grim perspective, right? Now, there are treatments for rheumatoid arthritis, and it kind of should, oh my god, that shows you the immune mechanisms, kind of fancy. So it starts with the immune cells that are activated and migrate into the synovial cavity, okay? Then T and B cells that produce antibodies, T cells that destroy tissue get activated, okay? They stimulate macrophages. Remember we talked about macrophages in the synovial fluid? Instead of consuming the little pieces of cartilage that are normal product of rubbing, they start to destroy cartilage themselves. They attack the cartilage non-specifically. And eventually, formation of the pannus, activation of osteoclasts. So in addition to ankylosis, the patient also develops osteoporosis in the advanced rheumatoid arthritis. Treatment. Now this are various anti-inflammatory drugs, immunosuppressants that are used for treating symptoms rather than underlying cause of rheumatoid arthritis. Now the reason, the reason, since we don't know the cause, it's really hard to treat disease, right? And there are so many aspects to it. However, recently we actually developed, well, I mean not me personally, scientific community. The last maybe 10-15 years, the new drug called rituximab was developed, and it's an antibody. So it is not, it's called biologics. It is a very effective and very specific immunosuppressant. Not like steroids, not like methotrexate, okay, which is kind of across the board. It's a very effective immunosuppressant that prevents or decreases autoimmune reaction in the joints, slows down the development. Does that make sense? It's not going to prevent, no, but it's going to slow down the development of the disease. Eventually, when joint becomes immovable, prosthesis of the joint has to be inserted. Does that make sense? Gouty arthritis. Crystals of uric acid. You can see the pathology right here. You can see the destruction of the joint. Microscopy of the cartilage and how it becomes dead and fragile and everything. So gouty arthritis is the deposition of uric acid in the joints, and then becomes inflamed. It's more common in men, and one of the major risk factors is, of course, age and alcohol consumption. So alcohol should be avoided because it increases production of uric acid. In the extended gouty arthritis, again, ankylosis is possible. There's no real treatment. Water to remove uric acid with urine, abstaining from alcohol, and drugs. Question? Well, I mean, dude, I have the same problem. So a couple of beers a day is fine. Maybe not if you have extended gouty arthritis, then it's a different problem. My dad has gouty arthritis. Well, first of all, we forgot to mention the main best treatment. Movement. When you move the joints, it delays the development of ankylosis, for example. So my dad, his sort of norm is exercise in a day, 10K to walk. He's retired, but every day he must walk 10K. He has arthritis in his feet. Okay? So he doesn't drink, but like on the regular basis, but like when we come over and we meet at family table, he may have couple of shots or couple of beers. That's about it. But he doesn't drink on a regular basis. But he is quite an extended, progressed. Okay, so not that being completely, free of alcohol. Lyme disease. Have you heard about it? How do you catch it? Ticks. Exactly. It's a bacterial infection. Not every tick carries Lyme disease. Not every tick that carries Lyme disease will give it to you. Okay? But do you really want to play that Russian roulette? So after the bite, the bullseye rash develops around the place of the bite. Okay? It's a fairly slowly developing disease. It may have other symptoms, cardiac problems, mental alterations, different types of motor impairments, but arthritis is one of the major manifestations of the disease. And the general advice, if you noticed this, go to the doctor. They will check if you really have the Lyme, probably you do, and they will prescribe antibiotics. The course of antibiotics is long because the bacteria at this point is probably systemic and everywhere. But you can cure this disease, and the earlier you start treatment, the less consequences you're going to have. In people with advanced Lyme disease, even antibiotic treatment may still leave them with neurological problems, like partial paralysis, joint pain sometimes. Okay. Now, this is the summary of the body joints. I'm not going to discuss this one, okay? Just to give you a perspective of synchondrosis, synostosis, syndesmosis, and other joints that we discussed today. I will post, we're not done here. I will post the